Hey, it's Jess, and I am a wife and mom of four living with metastatic breast cancer. And I am here using this channel to share my story, share about metastatic breast cancer for those that don't know, and to let those that are living with it as well know you're not alone and we're in this together. Today, I wanted to share what metastatic breast cancer actually is, what it means, what type of life expectancy it is, just a little bit about it. So, we'll start super simple. The word metastatic is what makes this type of breast cancer different from quote unquote regular breast cancer. I always thought that breast cancer was the easy cancer. You choose to have a lumpectomy, a mastectomy, and you're done. It's gone, it goes away. That's not the case. Metastatic is a breast cancer that has metastasized or spread to other areas. So the cancer is no longer just in your breast, it has spread outside the breast. Typical places that breast cancer spreads is your lymph nodes, which causes lymphedema. In one of my future videos, I'll talk about my lymphedema and how that came about. But it can spread to typical places. It spreads other places. Typical places it spreads your ovaries, your lungs, your liver, your bones, and your brain. Those are typical places. If you have cancer that has spread to those places, you are considered to have metastatic breast cancer, which is considered stage 4, which is terminal. There is no cure for stage 4 breast cancer. I believe I mentioned in my last video when they did the PET scan and found it in those other places. It's a little bit different. I had breast cancer in my liver. That does not mean that I have liver cancer or cancer of the liver. It is breast cancer that has spread to the liver. So someone who has liver cancer is going to get treated with different medicine than what I would get treated with because it's a different type of cancer that they are dealing with. There are different types of breast cancer, like subtypes. You have different stages, and typical just in your breast is stage 1. If it's spread to some of your lymph nodes, stage 2. I'm not exactly sure what is considered stage 3, but then stage 4 is that it has spread to your bones or other major organs. The average life expectancy of someone who is diagnosed with metastatic breast cancer is 18 to 36 months. That is a scary statistic. A lot of times, people think that to get breast cancer, it has to run in your family, which again is not the case. Only about 10% of people diagnosed with breast cancer have breast cancer in their family. I didn't have anyone with breast cancer in my family. So don't think that just because it doesn't run in your family doesn't mean that you have there's less of a chance of you getting it. 6% of women who have metastatic breast cancer, when they are first diagnosed. So when I first found out, when I was first diagnosed, I was already stage 4. I didn't find out when I was stage 1 or anything like that. So only 6% of women have metastatic breast cancer when they're first diagnosed. So I'm in that 6%. MBC, metastatic breast cancer, is not a chronic illness. A lot of times people think, oh, you just take a pill for the rest of your life and you're good. The definition of a chronic illness is one that does not affect the patient's life expectancy. Although women with metastatic breast cancer get treatments and scans for the rest of their life expectancy is lowered tremendously. Statistics show that only about 36% of women with metastatic breast cancer make it to the 5-year survival mark. That's so sad and scary. When you are diagnosed, no matter what age, with metastatic breast cancer, to know that that's the average, that's scary. It's really scary. And I'll talk in future videos about dealing with those emotions. 30% of people who have been treated for early stage breast cancer eventually develop stage 4. So a lot of women who choose to get mastectomies and lumpectomies and have radiation and go through chemo because they have stage 1, they just have a tumor in their breast. 30% of those women have a reoccurrence of stage 4. So just because you have breast cancer, stage 1 or stage 2, and you go through treatments doesn't mean you're in the clear. Please make sure you are still going to your doctor and getting checked and getting scans just to stay on top of things and make sure that you're still in the clear. Because I have stage 4, a lot of people will ask, oh, are you going to have a mastectomy? Are you going to have, or a lumpectomy? And most of the time, not always, but most of the time, women who are stage 4 don't have those types of surgeries. Once it has spread outside your breast, it's there. It's already in the rest of your body. So doing a surgery like a lumpectomy or a mastectomy isn't going to keep the cancer from spreading. That is why most women in the early stages will get those types of surgeries done. They'll stop it before it has the chance to spread. It still can spread, could have spread before, and those cancer cells are just sitting there waiting. But that is why most women who are stage 4 don't always have a mastectomy or a lumpectomy. It's already spread past the breast. Those types of surgeries aren't going to lower your risk of the cancer spreading because it has already done so. I hope that helps you to understand a little more about metastatic breast cancer and what it means for women who have it. Just because we may look fine does not mean that we always feel the greatest. Just because I come on here with a smile on my face and look okay doesn't mean that I always feel like it. So we are fighting for our lives. Literally, that is it. We don't want to be part of that statistic. We want to break that statistic. We want to get past that statistic of 18 to 36 months. So if you're watching this and you have any questions about metastatic breast cancer, please feel free to comment below. If you're interested in more videos about metastatic breast cancer, my journey, the emotions that it brings, all that kind of stuff, please feel free to subscribe so you'll get notifications when I post a new video. Thanks for watching.